if we look at a little bit of a sort of history of this, Professor Greg Haff and Professor Mike Stone first started looking at the isometric mid-thigh pull test back in about 1994-95, and first published on this in 1997. And as it pointed out, it's gained a lot of popularity probably in the last sort of 5 to 10 years, especially within the research. But at the same time, this has led to all sorts of problems. So one of the first couple of studies, which you've got the references on the screen here, that Dr. Haff published, they actually assessed the joint angles of just the knee joint from sagittal plane video. So the video was basically pointing in from the side, so they could get your knee joint angles during the mid-thigh or the second pull phase of the clean. And that's the way it was always originally meant to be. So the posture should replicate that second pull. And this is really, really important, because if you change the posture, you actually get a dramatic difference in the force time characteristics, whether it's peak force, force at certain time points, rate of force development, etc. They're all reliable. So if you standardize the joint angles that you're at between testing sessions, it will always be reliable and comparable if the same subject or the same athlete adopts the same posture. But this posture, the start of the second pull, always results in the highest forces and the highest forces at certain time points, or the highest rates of force development. However, if you look across all the research, and I'm not going to go through all of it now, but there's a huge range of differences in the postures that have been adopted and reported. Even in this image, there appears to be quite a large forward lean of the trunk, but this should only be a 5 or 10 degree forward lean. So the posture you should be adopting is pretty much that of the start of the second pull of the clean, or if you've got people that aren't familiar with the clean, if you're working with very young athletes, I know down at University of Wales in Cardiff that some of the researchers down there, part of Rodri Lloyd's group, have been looking at very young female gymnasts who don't perform the clean. Then the easiest way of getting them into the correct posture is get them stood upright, go into maximal dorsiflexion, push your knees over your toes, and keep your chest upright. And that gets you in the correct position. If it's collegiate level athletes or older athletes, maybe instruct them to sit as though they were sat on the edge of a bar stool. Obviously, you can't do that with younger athletes because they shouldn't know it. And that posture is the correct posture. But this is, as I've already said, this forward lean here is a little bit excessive. Some of the research that's out there actually recommends 175 degree hip angle. But if you have a 175 degree hip angle with this knee angle, you end up leaning backwards. Now, I've discussed that with some of the researchers, and that was because they were aiming to emphasize this 5 to 10 degree forward lean. So that's vertical being 180 degrees, 175 is 5 degree forward lean. But obviously that can lead to misinterpretation of the people trying to replicate this. And I also think pretty much every single manufacturer of force plates that promotes this test has posted images which are incorrect postures, which again in itself is problematic. Most people don't go and read the research, so won't figure that out, and if they do, that could lead to further confusion. So without going into a huge amount of detail over all those studies, what's recommended is between 125 and 145 degree knee joint angle. That depends on your level of dorsiflexion, and between 140 to 150 degrees hip joint angle, which leads to that 5 or 10 degree forward lean of the trunk. So if you are performing this test, don't just sit the other side of a computer screen, or if it's the Hawkin dynamic force plates staring at your tablet, move to the side of the athlete, check they're in the correct position, shoulders directly above or slightly behind the bar, and they're in pretty much a position of maximal dorsiflexion. And that should look like they're about to start the second pull phase of the clean. I've already said this gives you the highest forces, the highest rates of force development, etc. And it's really important because those do change if you change postures. And what you want to do is monitor your athletes over a period of time and know that you're comparing like with like, and that you haven't gone from a more forward lean of the trunk to a more upright trunk and immediately increased force production just due to a difference in posture. So if we look at what you really need to do, we've already mentioned the posture. So the first thing to do is get that posture correct. Ideally, make sure that the equipment you're using has a cold rolled steel bar so it doesn't flex. If the only thing you've got available is a normal Olympic weightlifting bar and you have to attach that to a power rack, etc., with ratchet straps, that's fine, but it will flex, so it will reduce your force at certain time points or the rate of force development. So if that's all you've got available, that's all you've got available, but it will limit that if you're comparing your values to that in the published literature, which has used a cold rolled steel bar. So what we've got to do is get this 125 to 145 degree knee joint angle, 140 to 150 degree hip angle, so a 5 to 10 degree forward lean of the trunk, so keeping your trunk as upright as possible. And then use a clean grip, so the same grip you would use if you're performing the clean. Don't use an opposing grip, that will still limit your grip, and use lifting straps. There's a little bit of research which indicates that your forces will be lower and your force at different time points and rate of force development will be lower if you're not using lifting straps. And most studies within the research have also used athletic tape and taped the hands onto the bar as well. So there's pretty much zero chance of you losing control of that or losing your grip. Also, if you can, standardize both the grip and the foot width. If you're working with young athletes, you might need to change this. You might not be able to standardize the foot or the grip width as they grow and develop and limbs get longer, etc. You can hopefully see on this image here, this is from Edith Cowan University. They've actually put a grid on their force plate to make sure that it's really easy to standardize that foot placement, not just between trials, but also between testing sessions. Once you've standardized all of that, what you need is your arms fully extended and your trunk needs to be rigid, but ideally minimal, if any, pre-tension. So what you should see in terms of the force trace is that force trace represents body mass. So it shouldn't really be any higher than that. Then, as Jason will have gone through in previous webinars, you need at least 1 second period of quiet standing. So that force trace should be pretty constant and shouldn't be changing. And ideally looking at less than a 50 Newton change in force during that time. Once they're in position, you then need to explain how they're going to perform the test, and it should be to drive their feet into the floor as hard and fast as possible. If you cue them to pull, what some people will do is actually go through more lumbar extension, lean backwards, and it almost looks like the end of a powerlifting style deadlift. That's not what we want. The aim is to assess maximal lower limb force production. So it's driving the feet into the floor, keeping the trunk as rigid as possible with no movement coming through the spine, and that should eliminate or massively reduce any discomfort that you may feel in the lower back. So that's the cue for them. Then you're going to give them a cue, 3, 2, 1, and then shout extremely loud, push, maybe keep shouting, push, 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 really encouraging them, strong verbal encouragement all the way through. You're aiming for about a 5-second drive into the ground, a 5-second effort. Once they've hit their peak and you see the force trace starting to decrease, it's not a major issue if they stop a little bit early. You will find there'll be breath holding as well. So if they're going from a sort of a red to a purple color and you're a little bit concerned, then stopping them a little bit early isn't a major issue. Give them about a 2-minute rest between efforts and then just repeat the process again. So it's a pretty simple cycle that you need to get them going through. Now, what we need to know is, well, what actually is an appropriate sort